afternoon, ladies and gentlemen. Thanks for attending the press conference today for the City of Charleston. I'd like to start with a few updated numbers for you and get into some of the objectives that we continue to work as an incident management team here in the city. Worldwide, there have been 3,303,296 COVID-19 related cases with 235,290 deaths as of 3/38 today. That's according to Johns Hopkins. In the United States, we're at 1,082,411 cases with 63,127 deaths. In South Carolina, according to the DHEC's latest report as of 4 p.m. yesterday, there were 6,095 cases statewide and 244 confirmed deaths in the state. In the county, Charleston County had a total of 444 cases and 7 confirmed deaths. And for Berkeley County, we're at 180 cases with 10 confirmed deaths attributed to COVID-19. The incident management objectives that we continue to work since really the beginning of this, with one new one, we've maintained the situational awareness of all COVID-19 cases in the city of Charleston. We aspire to limit exposure to the COVID-19 virus, to keep order in the city, to preserve the city's government workforce, to assist the medical community in mitigation of COVID-19, and the sixth and newest one is to assist citizens with housing instabilities to achieve stable housing prior to the onset of hurricane season while minimizing the transmission risk to COVID-19. Obviously, with it being May 1st, we're about a month out from the beginning of hurricane season, actually exactly a month out, starts June 1st, so we have our hurricane task force that is keenly focused on some of our objectives separate to COVID-19, but that sixth one ties in nicely. I want to take a moment to focus on Objective 4, which is to preserve our government workforce. Obviously, this crisis is evolving. We're not finished with it yet. We're seeing some flex in terms of some parks opening, as we can see today. Some businesses are going back to work, and so we want to take an opportunity to impart upon you some of what we've done as a city to ensure the safety of our employees, and we want to encourage employers in the city of Charleston to maybe follow some of those examples. We understand the need to communicate to you all, particularly our employees throughout the city. Some of the processes we've done to ensure we protect our workforce include personal protective equipment, making sure that we have a solid stockpile of PPE, and we have a program in place to manage the burn rates of that personal protective equipment. We've utilized flexible office hours and tried to establish protocols for folks to work in specific workspaces and sort of alternate in that way. And then most recently, we're looking at this serology testing, where we've partnered up with the medical university to establish some protocols for serology testing over the coming days. MUSC has reported that serology testing has begun in the city and Charleston area for healthcare providers and first responders. They're working with city officials to significantly broaden testing as soon as possible. Serological testing is done through a blood draw and has the ability to detect antibodies that may indicate a past infection from COVID-19. However, it is important to note that there are limitations with serology testing and that antibodies may not be present in the early phases of infection and should not be used as a sole method of diagnosis of COVID-19. It is also not yet completely understood how long immunity may last. So that's just another one of the ways, as this is evolving, that we're working to make sure we flatten that curve as much as we can. I want to take an opportunity to thank Charleston County and Federal Healthcare for putting together a mobile testing resource, which will be made available in the city of Charleston on 3 separate dates. They've released dates and locations for COVID-19 mobile screening and testing. These sites will offer walk-up and drive-through stations and are scheduled to be set up each day across Charleston County, Monday through Friday, May 4th through May 18th. 3 sites have been selected within the city. May 8th be at the Magistrate Court on Morrison Drive. May 11th at St. James Presbyterian on Secessionville Road, and May 12th at the Johns Island Library on Maybank Highway. Each site will be scheduled to operate from 9 to 4 p.m. every day. Individuals experiencing cough, fever, and shortness of breath can request a screening at federcovid19screening.org or by calling 1-800-365-7410. Again, 1-800-365-7410. And with that, Mr. Mayor.
Well, thank you, and Shannon, as always, does a great job with the numbers, with the able assist of Alfonso Procopio that works with our team as well. So, and I won't focus much on the numbers, although as I've done these press conferences, remarks, I've always noted over the last few weeks how the percentage of the cases in the United States as a total of the world cases continues to rise, and it still does. When I first started noting this, it was about 25% of world cases were in the United States. Now we're up to 32.4%. So literally almost just right at a third of all cases in the world are in fact in the United States. And I'll point out a couple local statistics that Berkeley County's numbers, really are pretty low, with the exception they had that one nursing home that had almost over a third of the cases within the county are from one place. And that accentuates the need for us to continue to be mindful of the elderly and those with underlying health conditions in all that we do. Now, regarding Charleston County's numbers, today at 444, but we really kept the rate of increase low, particularly over the last 2 weeks. So frankly, I'm very proud of the citizens of Charleston County for their responsiveness and being home and being smart and keeping the spread of corona down in Charleston County. Today it's May Day. It's May 1st, right? April was a blur, right? We've been living this world of coronavirus, and folks, I just want to let everyone know that we're arriving at a new normal. Of course, some people would call it a new abnormal, and we have to continue social distancing, practicing hygiene and cleanliness and all those protocols that the CDC and DHEC recommends. But we're going to get through this. We made it to May. We're going to be okay. We have to continue to stay smart and stay well. And so we may have temporarily lost some of our options to go to restaurants and movies and things like that. But I urge our Charlestonians, fellow Charlestonians, that we're not going to lose our friendliness, our good nature, our willingness to help one another. Those are core values and traits that we're going to maintain. So things are going to start to open up a little more. The governor has an initiative you all know about called Accelerate South Carolina. It's a group of business and healthcare leaders from around the state to think about the ways that we can safely open back up in the state of South Carolina. So in a similar fashion, I'm pleased to announce today that a group that's under the umbrella of the Charleston Regional Development Alliance, that's known as One Region, has announced a very collaborative effort among our business community, among our chambers, among our healthcare professionals, nonprofits, local governments, one of the most collaborative groups that's ever been established in the Charleston region, all three counties, to establish a consistent roadmap for employers and residents to inspire the confidence that we need to prepare as we safely open our local economy. And they've sent out a separate press release today about the plans that they're working on, and it will be specific to different business sectors and specific to our region. So we look to work hand in hand with the governor's guidance and his efforts, Accelerate South Carolina, and the local group called One Region to guide us to safely reopen business and more of a normal way of life here in the Low Country. So I'm very excited about that. Underlying principles of all these efforts is safety. And we achieve that through continuing testing. And early on, we just focused on the testing as to whether you had the virus or not. They call that the disease testing. And that continues on. Shannon just mentioned, with kudos to Charleston County and Feder Health Clinic, those tests that they will be providing on a daily basis throughout the county are for the disease. Now, the Medical University and Roper and Trident hospital systems are all working on this next phase of testing, the serological testing. And that will really be kicking off the ground next week with MUSC leading the way. So you got the testing that needs to continue to occur, so that if you find another individual that tests positive to the disease, that we have the contact tracers in place to immediately track down, like a surgical strike, where that contagion came from for that individual, so that we can prevent further spread, further spikes, while we reopen our economy. And so DHEC is hiring a core of contact tracers, mostly folks that have medical experience. And they've been using high school health nurses, they've been using medical students, and hiring some furloughed healthcare workers from the medical universities and other healthcare systems that have been laying off some folks. And so we're not there yet. We're still building capacity for both contact tracing and testing, but both of those components are critical as we move forward to safely open. And I will remind everyone one more time that we really need to be mindful of the elderly and those with underlying health conditions. If you look at all the statistics from around the world of who's dying as a result of the coronavirus, it's mostly folks that had some other health condition in the first place. So I think Shannon mentioned, for example, here in the city of Charleston, not to pry, but we asked our employees if they would self-identify whether they had one of these underlying health conditions, like a heart condition or diabetes, so that we could be extra mindful, pay extra attention to their workplace environment, and trying not to expose them to the general public and so forth. Same thing applies particularly to nursing homes. I mean, that's one of the very last things that's going to unfold as we reopen things, is visiting nursing homes and exposing folks who are in the nursing home, because you've seen what has happened there. So I'll just leave you with this thought that as we make these plans to reopen businesses and try to get back to a normal way of life, it's not like flipping a switch and instantly everything's back to normal. We're going to be stepping this thing through one step at a time, and have the mindfulness to monitor the numbers as we go, and have the testing and contact tracing in place, so that as a case emerges, we're able to track it down and be able to continue opening without creating risk for our city and our citizens. And a big part of this also, and we're doing a good job here, folks, is that our healthcare system to date, unlike some other places in the world, has been able to handle the cases that have emerged here in Charleston region and the Tri-County area. MUSC, Roper, Trident, East Cooper hospitals, they've been doing a great job. The numbers are such that they can handle it. And that gives us some confidence that it's time to start loosening things up and opening up a step at a time, not all at once, so that we do get back to a good place of normalcy, but safely. So, having said all that, I meant to start by saying how nice it is to be back in the park. We did officially reopen city parks just today, but the theme of opening the parks, despite that I'm standing here just speaking to you right now, is keep moving. You got to move. And so our parks are open for folks to be able to walk and jog and traverse, but not for gatherings, not yet. That will come with time. And but we're so pleased on such a beautiful day here in Charleston to be able to reopen parks and let our citizens get a little sunlight. Maybe they'll build up a little vitamin D, which is a healthy thing, and a little peace of mind as well to get out of the house. So after all that, without further ado, I'd like to call Chief Luther Reynolds to come forward and make any remarks and respond to any questions y'all might have for the chief.
Greetings, everybody. Thank you, Mayor. There's two words that I just want to emphasize. One is balance, and the other is responsibility. Balance is the mayor, the city council, the leadership here in a collaborative way within our region, all of our partners in law enforcement, fire rescue, EMS, everybody has been closely in sync. And so the mayor alluded to a couple things. One is the parks are opening up today. Last weekend we opened up the boat ramps and the waterways. There's discussion, maybe next week the governor has discussed having dining in outdoor areas and restaurants. Those are all exciting things. I'm excited that the parks are open specifically. That's exciting. We have over 100 parks in the city of Charleston, one of the most beautiful cities on this planet. And we're standing in one of those many beautiful parks. So the balance is to begin opening things back up. The balance is to look at it through a legal sense, a lens, through a lens of science, as the mayor has done all along with the doctors and all the experts and the epidemiologists and everybody, and saying, okay, when is that time? And that time is beginning to occur. But as we find that balance, here's what I would ask publicly. I would ask that our citizens be responsible. When we talk about social distancing, when we talk about being out on the waterways, when we talk about being in the parks, as the mayor mentioned, our expectation is that people move and they recreate, not gather in large groups, not play on the playground equipment, for example, which we cannot clean and we can't really keep up with some of those things. Some of our buildings and facilities will remain closed initially, and that'll be a later stage when some of those things will be opened back up. We don't want large events like lacrosse games or football games or things like that. We want to keep our parks open. If we together do that responsibly with social distancing and continue to practice a lot of the things that we've done so far, we can continue on that balanced progression. So I just want to thank our partners. I want to thank the mayor and the council, and I want to thank most of all the citizens in our communities for their patience, for the tremendous amount of sacrifice that they've given so far. There's been so much accomplished so far. We don't want to change this trajectory, this positive momentum. And so I would just ask all of our citizens to continue to do what we've been doing very well. But we have people in the parks. You'll see them out there if you haven't seen them already, from the rec department, from our parks department, from our livability, citizen employees, non-sworn employees, ambassadors is what we're calling them, reminding people. And if you are in a park and they ask you, please continue moving, please use good practices, please be respectful and listen to those people. It may not be their normal job, but they're out there because they want to keep the parks open. They want to keep people safe. And we're all doing this together. It's worked really well so far. Let's continue on that path. So thank you so much.